There's still a great unmet need in both autism spectrum disorder and an obsessive compulsive spectrum disorder for individual patients and for the population as a whole. One of the points that I made, for example, with autism is that people present at different ages with different kinds of chief complaints or target symptoms. Again, some people present with severe aggression or self-injury. Some people are presenting because they're not talking. Some people are presenting because they have seizures. Other people are presenting because they're uncomfortable and they don't have skills in social interactions. They don't know how to initiate or maintain a conversation. And other people are presenting later on because they have problems that interfere with their functioning in the workplace or in relationships as well. And we don't have treatments for a whole range of these different kinds of symptoms. So there's a huge unmet need in terms of developing new treatments for different symptom domains in autism spectrum disorder. We really want to develop breakthrough treatments that facilitate social communication, that help people so they have better eye gaze, so they understand better what other people are thinking or feeling, that they have more appropriate interactions and social interactions, or that they can advocate for themselves in a job-related situation, or that they're able to live independently, for example. So those are huge unmet needs. Also, it turns out that many individuals who are high functioning in the autism spectrum may make it to high school, for example, or college, but they don't have the skills both to form social networks. They may not have the academic skills or the organizational skills to keep up with all of their classes, for example, and they may have a hard time advocating for themselves, getting the resources that they need, in order to be fully functioning. So the biggest unmet needs in autism, for example, is to help individuals so they can function in the mainstream, so that they can hold a job that gives them benefits, that they can perform well in an educational setting, for example, that they can live independently rather than in a residential home, for example, or at home with their parents. So there are huge unmet needs in that population. Also, it turns out, given that the disorder is heterogeneous, we need to develop better personalized treatments. So we have to identify what are the underlying mechanisms in that individual, specific gene mechanisms or inflammatory mechanisms or environmental factors that might help us to pick the optimal treatment for that individual. It's a little bit like oncology, for example, where we're developing more personalized treatments based on the underlying mechanisms that are involved in that particular patient. And so personalized treatments are going to be much more important in autism spectrum disorders as well.